When we talk about successful blood collection in modern clinical practice, one of the most valuable tools nurses rely on is the winged butterfly needle phlebotomy blood collection set. This device has become especially important in situations where patients have small, fragile, rolling, or difficult veins. In many healthcare settings, nurses encounter pediatric patients, elderly individuals, oncology patients, and those with dehydration or chronic illness, where standard needles may create unnecessary discomfort or repeated failed attempts. The butterfly needle helps bridge that gap between precision and patient comfort. What makes this collection set unique is its thoughtful design. The small gauge needle, flexible tubing, and winged grips allow for greater control during venipuncture. Those small wings are not just for appearance. They provide stability and make it easier to guide the needle into delicate veins with accuracy. The attached tubing also reduces movement at the insertion site, which lowers the chance of vein collapse or patient discomfort during collection. For nurses, this added control can significantly improve confidence, especially during challenging blood draws. Another reason this device is widely appreciated is the patient experience it creates. Many patients arrive anxious the moment they hear the words blood collection. Some have experienced painful venipuncture in the past, while others fear needles altogether. The butterfly needle often allows for a smoother, gentler insertion, helping nurses establish trust quickly. A calm and confident technique reassures patients that they are in capable hands, and that emotional reassurance can be just as important as technical skill. It is also important to understand when the butterfly needle should be chosen over a straight needle. Nurses must assess vein size, depth, visibility, and patient condition before deciding on equipment. The butterfly set is particularly useful for hand veins, superficial veins, and veins that are prone to collapsing under pressure. In emergency rooms, outpatient clinics, laboratories, and long-term care facilities, selecting the right device can determine whether the procedure succeeds on the first attempt or becomes stressful for both patient and nurse. At the same time, proper familiarity with the equipment is essential. Nurses should understand each component of the set, including the needle bevel, safety mechanism, tubing connection, and collection adapter. Knowing how these parts function together improves efficiency and reduces the risk of accidental injury or contamination. A nurse who is comfortable handling the device can focus more attention on the patient rather than the equipment itself. Beyond technical benefits, the butterfly needle represents a broader principle in nursing care, combining skill with compassion. Blood collection is not merely a routine task. It is often one of the first direct interactions patients have with healthcare professionals. The way a nurse performs this procedure can shape a patient's perception of care, professionalism, and safety. Every steady hand, every calm explanation, and every successful collection contributes to better patient trust and overall healthcare quality. Mastering the winged butterfly needle blood collection set is not simply about drawing blood efficiently. It is about delivering comfort, confidence, and compassionate care with every patient encounter. Once we understand the importance of the winged butterfly needle blood collection set, the next step is mastering the actual procedure with confidence, precision, and consistency. A successful blood draw does not begin with needle insertion. It begins long before that moment. Preparation is one of the most critical parts of phlebotomy, and experienced nurses know that proper organization prevents complications and builds patient trust immediately. Before approaching the patient, every necessary item should already be prepared and within reach. This includes gloves, alcohol swabs, collection tubes, tourniquet, gauze, sharps container, and the butterfly needle collection set itself. A well-prepared nurse appears calm and professional, which naturally reassures the patient. The environment also matters. Good lighting, proper positioning, and a stable surface all contribute to safer and smoother blood collection. Equally important is communication. Patients should never feel like they are simply part of a routine procedure. Taking a moment to introduce the process, explain what they may feel, and answer brief concerns helps reduce anxiety significantly. Many patients become tense during venipuncture, and that tension can make veins more difficult to access. A calm conversation can often improve cooperation and even enhance vein visibility. Patient positioning is another detail that nurses should never overlook. The patient should be seated or lying comfortably with the arm supported and extended. Stability is essential because sudden movement during insertion can lead to pain, bruising, or accidental injury. Once the arm is positioned, the tourniquet should be applied carefully to help identify a suitable vein. At this stage, assessment skills become extremely important. Nurses must evaluate vein size, direction, elasticity, and accessibility before deciding on the insertion site. When using a butterfly needle, the insertion angle is typically lower than with a straight needle, which allows for smoother access into superficial veins. After cleansing the site properly and allowing it to dry completely, the nurse stabilizes the vein gently and inserts the needle with controlled precision. One of the advantages of the butterfly set is the increased control it offers through the winged grip, allowing nurses to guide the needle more steadily and comfortably. The moment blood flashback appears in the tubing, proper collection technique becomes the focus. Tubes should be connected carefully without unnecessary movement that could disturb the needle placement. Maintaining a steady hand throughout the procedure reduces discomfort and protects vein integrity. Nurses should also remain attentive to the patient's condition during collection. Some individuals may feel dizzy, anxious, or uncomfortable, and recognizing these signs early is part of safe patient care. Once the required specimens are collected, the tourniquet should be released before withdrawing the needle. Gentle pressure with gauze helps prevent bruising and promotes patient comfort. Activating the safety mechanism immediately after removal is essential for preventing needle stick injuries and maintaining workplace safety standards. Proper disposal of sharps and accurate labeling of specimens complete the procedure responsibly and professionally. What may appear to patients as a simple blood draw is actually a process that combines preparation, technical skill, observation, communication, and compassion. Every step matters, from the first interaction to the final bandage applied at the collection site. When nurses approach phlebotomy with patience and precision, they not only improve specimen quality, but also create a safer and more reassuring experience for every patient. Excellence in blood collection is achieved not through speed alone, but through careful technique, confident practice, and compassionate patient care. One of the most important goals in phlebotomy is not simply obtaining a blood sample, but doing so in a way that protects patient comfort while reducing the possibility of collection errors. Every nurse understands that a patient may forget many details of a hospital visit, but they rarely forget a painful or difficult blood draw. That experience can shape their confidence in healthcare professionals and even influence their willingness to cooperate during future procedures. This is why the use of the winged butterfly needle collection set becomes such an important part of compassionate and effective nursing care. Patient comfort begins with the nurse's approach long before the needle is inserted. A calm tone of voice, confident body language, and simple explanations can immediately reduce anxiety. Many patients fear blood collection because of previous painful experiences or repeated failed attempts. Some become nervous the moment they see the equipment. Nurses who acknowledge that fear with patience and reassurance often notice a significant improvement in patient cooperation. When patients feel respected and informed, their muscles relax, veins become easier to access, and the entire procedure becomes smoother. The butterfly needle is particularly valuable because it allows for greater control and gentler handling of delicate veins. Its smaller gauge and flexible tubing reduce pressure on the vein, helping minimize discomfort during insertion and collection. This becomes especially helpful for elderly patients, pediatric patients, oncology patients, and individuals with fragile veins. In these situations, precision matters greatly because repeated attempts can quickly lead to bruising, swelling, pain, and emotional distress. Reducing collection errors is equally critical. A successful blood sample must not only be collected safely, but also remain accurate for laboratory analysis. Hemolysis, clotting, contamination, and insufficient specimen volume are common issues that can occur when proper technique is not followed. These errors may lead to repeated blood draws, delayed diagnosis, and frustration for both patients and healthcare staff. Nurses play a direct role in preventing these complications through careful technique and attention to detail. For example, choosing the correct vein and maintaining a stable insertion angle helps preserve blood flow and reduce trauma to the vessel. Excessive movement of the needle during collection can damage red blood cells and increase the likelihood of hemolysis. Using proper tube order, gentle handling, and correct filling procedures also contributes to specimen integrity. Even something as simple as allowing alcohol to dry completely before insertion can improve patient comfort and prevent unnecessary stinging. Another important aspect is recognizing when adjustments are needed. Skilled nurses observe the patient continuously throughout the procedure. If blood flow slows, the patient reports pain, or swelling begins to appear near the site, immediate action should be taken. Quick assessment and calm decision-making prevent minor problems from becoming serious complications. This level of attentiveness reflects both clinical competence and professional responsibility. It is also essential to remember that patient comfort extends beyond physical pain. Emotional comfort matters just as much. A nurse who remains patient, avoids rushing, and maintains professionalism can transform a stressful procedure into a manageable experience. Small actions, such as maintaining eye contact, offering reassurance, or simply explaining each step, help patients feel safe and cared for during the process. Ultimately, excellence in phlebotomy is measured not only by technical success, but by the quality of the patient experience and the reliability of the specimen collected. When nurses combine precision with empathy, they create an environment where safety, comfort, and clinical accuracy work together seamlessly. The true success of blood collection lies in making every patient feel safe, respected, and confidently cared for from beginning to end. As we bring all these principles together, it becomes clear that successful phlebotomy is built not only on technical knowledge, but also on consistency, safety, and professional confidence. The winged butterfly needle blood collection set is an excellent tool, but like any medical device, its effectiveness depends on the skill and responsibility of the nurse using it. Every blood collection procedure carries a duty to protect both the patient and the healthcare professional, and that is why best practices and infection control must always remain at the center of nursing care. One of the most important habits any nurse can develop is strict attention to standard precautions. Regardless of the patient's condition or setting, every blood draw should be approached with the same level of care and protection. Proper hand hygiene before and after the procedure is essential. Gloves should always be worn appropriately, and all equipment must remain sterile until the moment of use. Even small lapses in infection control can increase the risk of contamination, specimen errors, or exposure to bloodborne pathogens. The butterfly needle collection set includes safety features designed to reduce accidental needle stick injuries, but those features only work effectively when nurses use them correctly and consistently. Activating the safety mechanism immediately after needle withdrawal should become automatic practice. Delaying disposal or attempting to recap needles creates unnecessary risk and places healthcare workers in danger. In busy clinical environments, fatigue and distractions can sometimes lead to shortcuts, but safety must never depend on convenience. Sharps disposal is another responsibility that reflects professional discipline. Used needles should always be placed directly into approved sharps containers without passing them from hand to hand or leaving them exposed on work surfaces. Safe disposal protects not only the individual nurse, but also co-workers, cleaning staff, and patients within the healthcare environment. Every safe action contributes to a culture of accountability and prevention. Confidence also plays a major role in successful phlebotomy. Patients can immediately sense hesitation or uncertainty, especially during procedures involving needles. This is why ongoing practice and continuous learning are so important for nurses at every level of experience. Confidence does not mean rushing through procedures or assuming perfection. True professional confidence comes from preparation, repetition, and understanding how to respond calmly when challenges arise. There will always be situations where veins are difficult to locate, blood flow is limited, or patients become anxious during collection. What matters most is how the nurse responds in those moments. Staying composed, reassessing the situation carefully, and prioritizing patient safety demonstrate professionalism far more than speed alone. Nurses who continue improving their technique through training and observation become more adaptable and more effective over time. Another key element of confidence is communication within the healthcare team. Nurses should never hesitate to seek assistance when needed or share knowledge with colleagues who are still developing their skills. Strong teamwork improves patient outcomes and creates a safer clinical environment for everyone. Mentorship and collaboration remain essential parts of nursing practice, especially in procedures that require both technical precision and patient-centered care. At the heart of all these practices is the understanding that phlebotomy is far more than collecting a blood sample. It is an opportunity to demonstrate professionalism, compassion, safety, and trust in every patient interaction. Each carefully performed procedure reflects the standards and integrity of the nursing profession as a whole. When nurses combine skill, safety, confidence, and compassion, every blood collection becomes more than a procedure. It becomes a reflection of excellence in patient care.